recording starts, okay?
Okay.
This meeting is being recorded.
Welcome and thank you for joining us today for the July 11th meeting of the New York City Health and Hospitals Audit Committee. Today's meeting is officially called to order. I'd like to start by proposing a motion to adopt the minutes of the Audit Committee meeting held on May 9th, 2022. May I please have a second?
Second.
Okay, and I'll poll each member for their vote. Jose Pagan,
Yes.
Dr. Katz,
Yes.
Frida Wang's not here. Fanny,
Yes.
Benyamova, and Anita Karacha.
Yes.
Okay, now we're going to have an audit update from Catherine Patsos.
Good afternoon, everyone. This is Catherine Patsos, Chief Corporate Compliance Officer, providing the report for internal audits. Starting on page 3 of the report, with regard to the New York City Comptroller's Office audit over nursing homes inventory, we had a draft audit report was received on June 7th, to which we responded, and a final report was issued on June 29th. In the final report, the Comptroller's Office made 4 recommendations that we all agreed with. In addition, we clarified some of the findings that were stated in the draft audit report and emphasized that the audit was conducted during the height of the COVID-19 public health emergency, when we had alternative inventory processes in place. The final report incorporated many of the elements of our response and also recognized that the audit was conducted during the height of the pandemic, when our facilities were significantly impacted, and it acknowledged the difficult circumstances under which we were operating at various points during the audit. The recommendations were that we ensure that cycle counts and fiscal end counts are conducted in accordance with our protocols, and that any discrepancies that are identified are investigated, and that all items that are recorded and tracked are in inventory records, whether that be in PeopleSoft or in manual records. The second is that if staffing permits, we should segregate responsibilities for handling and issuing items, recording of the issuing of items, and conducting the periodic counts. If that segregation of duties is not feasible, then we should implement compensating controls, such as increasing the reviews of inventory-related transactions at the managerial or supervisory level. Third, we should ensure that our access controls in PeopleSoft align with the duties and responsibilities of its users, which is basically making sure that the roles are properly assigned. And finally, ensure that all inventory balance adjustments are documented, and the adjustments are authorized by someone who does not have physical custody of the inventory. Does anyone have any questions?
Just a quick note. Your first paragraph probably should say on June 7th.
Yes, you are correct. It says you'll be on
Yeah,
June 7th.
okay. Mhm.
I apologize.
Okay.
Okay. Moving on to page 4. This deals with the internal audit of nursing hiring, and this audit is going to evaluate the onboarding of nurses, including direct hire, agency, and temporary nurses, to ensure that their background checks were conducted properly, such as their fingerprinting, the employment eligibility, and their licenses. Make sure that they had annual performance evaluations conducted, and that the documentation was maintained as properly. In May 2022, the internal audits received the data regarding the universe of all such nurses during the audit period. The Office of Corporate Compliance took that data and used RATstats to draw randomized samples for each of the agency, travel, and direct hire nurses from Lincoln, Elmhurst, Harlem, Kings County, Jacoby, and Bellevue, which were the facilities with the largest number of nursing census. On June 13th, internal audits met with nursing administration to discuss the documentation that they need to perform the work, field work on the samples, and that collection is ongoing. Are there any questions regarding the nurse hiring audit?
I meant to mention for the controller's audit that you noted the audit was originally initiated by the former controller.
That is correct.
Yeah.
And the final report was issued by the new controller,
Right,
but the auditors remained the same.
okay. Maybe the attitudes changed, who knows?
Who knows? They did seem more accommodating or sympathetic, perhaps, as we had several discussions with the auditors. So we were engaged with them at several steps along the way.
Thank you.
Finally, on the auxiliary audits, we have an audit firm, the Bonadio Group, that does these auxiliary audits. They have, for 2021, they have completed 22 reports. Internal Audits has reviewed 10 of them, and there are 9 of those 10 were compilations, and 1 was a review based on the auxiliaries' revenues. There are 3 reports outstanding for 2020. Those include Friends of North Central Bronx, Elmhurst Hospital Center, and Queens Hospital Center. And finally, there is 1 draft report has been completed for each of 2018 and 2019 for Queens Hospital Center, and those final reports are expected later this month. If you recall, that was upheld due to the reinstatement of its 501c3 status and retroactive effect of that. Any questions?
Okay, I guess I'll poll each member for questions for both the audit update. And so Jose Pagan,
No questions, thank you.
Dr. Katz,
No questions, thank you.
Frida Wang, she's not here, Benioski Peñamora.
I just have a question about the nurses audit report. As we're moving forward, do we see any concern with respect to what was presented on the report, or do we think that everything that was highlighted has been covered kind of completely?
Well, the recommendations that they made, as I mentioned, are recommendations that we all agree with and will be implementing if we have not already. We do, for example, normally have access controls in PeopleSoft that align with the staff person's or individual's responsibilities. We do have separations of duties that will just be reinforced. And so some of the, the cycle counts, for example, are things that we are going to definitely put in place this year. And let's see, and they also will be implementing that we have inventory balance adjustments documented, and that they are authorized by someone who does not have physical custody of the inventory. So most of them
But
are.
my question is,
Yes, I'm sorry.
my question is more that, my past experience, sometimes the audits that come from the controller, there are areas that we disagree in terms of what their statements were or their
Okay.
findings.
Right.
If we find any that we disagree and we said we're not implementing it, that's what I'm trying to
Yes.
get to. Sorry if I didn't ask
Okay,
correctly.
I understand. Yes, we specifically called out that the finding that Carter did not institute cycle counts for more than a year, and indicated that they did perform manual cycle counts in lieu of the cycle counts in PeopleSoft, and we provided 38 weeks of data on that, and they did acknowledge that in the report. We also emphasized that, we do have separation of duties, and they acknowledged what we said, but also said that there were instances where they found that that did not occur. And we also made clear that we do not condone or permit any password sharing, and that we only grant user rights to individuals that are tasked with entering the account results into PeopleSoft. But they acknowledged that as well, but they did counter that they did see that happening. But we basically were trying to say that, as a general matter, that does not happen.
Thank you. This is very helpful. Thank you.
Okay.
Okay, Anita Kawatra, did you have any questions?
No questions, thank you.
Alrighty. Now we're going to have, where are we now? Compliance update from Catherine Pop.
Okay. Starting on page 2 with the monitoring of excluded individuals and vendors. In the reporting period of April 20, 2022 through June 15, 2022, we had identified 2 community physicians who were excluded by the Office of the Medicaid Inspector General. We are still reviewing whether any repayment is required as a result of any services that they might have provided during that period. We're looking into whether they actually did furnish services and whether any of those services were billed by health and hospitals. There were no providers identified on the National Plan and Provider Enumeration System or on the Death Master file. Moving on to page 3, paragraph 8. During the reporting period, there were 43 incidents involving allegations of HIPAA violations. Of those 43, we found that 12 were determined to be violations of our HIPAA privacy and security operating procedures. 6 were found not to be violations, and 25 are still under investigation. Of the 12 that were violations, 3 were determined to be breaches. 2 of those breaches resulted from registration errors, such as selecting the wrong patient record to register a patient, and 1 involved giving a patient the wrong after-visit summary. Are there any questions so far?
Just that we mentioned following
Yes.
through on matters that are under investigation.
Yes.
Updated.
So, yes,
Yeah.
at the next meeting, I will be updating the committee on the 25 that are currently under investigation. Moving on to paragraph 10, we received 1 letter from the Office for Civil Rights that was dated May 31st, 2022, and it regarded a complaint that it received from a former New York City Health and Hospitals Harlem employee who was also a patient, and reported to the OCR that several staff members who were not involved in this individual's care had access to medical records from her hospitalization, and discussed that information with others, which she felt caused an uncomfortable working environment, which she claimed led to her resignation. This was a follow-up to the OCR's original letter, next page, that was dated February 23rd, 2021, which also requested that we send the OCR data regarding this complaint. The OCC, Office for Corporate Compliance, responded to that letter on March 30th, 2021, and provided the requested data, which demonstrated that the individual's claim was unsubstantiated. In its May 31, 2022 letter, the OCR also concluded that there was insufficient evidence to substantiate the claim that we violated the privacy rule with regard to this particular individual.
Okay.
Moving on to compliance reports. The OCC received 66 compliance reports during the reporting period. These reports are all colored with a red, yellow, or green flag, depending on the severity of the report. We received 5 red reports, 31 yellows, and 30 greens. The 5 reports were characterized as patient abuse. 3 of them were referred to the respective facility for investigation. 2 were not substantiated. 3 of the 5 were all dealt with the same individual. The complaints centered mainly around the care provided or medication administered. That was in large part, and even when the ones that were referred to, the facilities were also unsubstantiated. And moving on to page 7. So as you know, we are in the process of selecting a billing and coding auditing vendor to provide those services. We received, as I'd mentioned before, we had received 6 proposals. We selected 2 of those. Move on to the next slide. Paragraph 15, we invited 2 of the highest scoring vendors to make presentations on their proposals, and the scoring for that will follow. And we hope to select a vendor by the middle of July.
I think this will be a significant audit for us to follow. While it's probably going to be expensive, it will hopefully have positive revenue implications.
Yes,
Right.
absolutely. And moving on to paragraph 16, with regard to the fiscal year 2023 risk assessment and corporate compliance work plan. As I believe I mentioned in the prior meeting, we did develop a draft FY 2023 risk assessment, and that was presented to the Enterprise Compliance Committee on March 24th for their review. I revised based on their comments and prioritization to the risk, that draft was revised and presented again to the ECC on May 5th for further discussion. Once that was approved, I drafted or prepared the draft fiscal year 2023 corporate compliance work plan, and they reviewed that and provided their comments to that. This work plan will be presented to this committee for their review and approval. Okay, moving on. The next paragraph, this is related to our Hipaa risk analysis and security assessment. For this assessment, we engaged Coalfire. Let's move on to page 9. In April, they did reviews of the acute care facilities and on-site reviews of certain facilities in May. They will be reviewing the DNTCs and their associated clinics in June and throughout July. And as an added note, in addition to reviewing the individual facilities, Coalfire also conducts an enterprise-wide review of our HIPAA privacy and security compliance. And due to the remediation of previous high and very high risks from prior years on the system level, we were able to eliminate many of the risks that came in at those particular levels. So we will now start to review the moderate risks for 2022, which means basically that we had eliminated many of the higher risks. So now we could work on the moderate risks. So that was a significant improvement over prior years. And that concludes my compliance office report.
Okay. Are there any questions about any of the reports that Catherine's made? Jose? Pagan,
No questions, thank you.
Dr. Katz,
No questions, thank you.
Benioski Peñamora,
No questions, no questions.
Anita Quatra.
No questions, thank you.
Thank you. Okay. I now would like a motion to go into executive session where we're going to have a presentation of the FY23 corporate compliance work plan from Catherine. Catherine, we haven't seen this work plan yet. Is that correct?
No,
Okay. All right. May I have, I make the motion. Can I have a second?
Second.
Okay, we're in executive session.
Sally, hold on 1 minute, please. There's a separate link for that because we're in public session still. I just sent it out.
Okay.
To join that link. We're gonna put this public meeting on hold until we finish, okay?
Got it. Okay.
So do we leave this meeting and go to the other meeting? Is that correct?
Yes.
Okay.
Yes.
So see you in the
Okay.
next meeting.
Should we have a vote? No?
Oh, didn't I take a vote? I'm sorry. Let's have a vote on that. Jose Pagan,
Yes.
Dr. Katz,
Yes.
Rita Wang,
yes.
Benioski Peñamora,
Yes.
and Anita Kawatra.
Yes.
Okay, so we are to say during the executive session, the committee received, reviewed, and approved the FY 2023 corporate compliance work plan. Is there any old business to be reviewed? Is there any new business? There being no further discussion, the meeting is hereby adjourned. Thank you all.
Thank you. Thank you, everybody.
Bye-bye.
Bye.
We're going to the finance committee. Is that correct? No?
That is-
Yes.
Yeah. Okay. See you there. Bye-bye.
Bye-bye.